people are investigating is looking at structural MRI and whether there might be changes in the structure of the brain early on before the symptoms emerge. Now, this is really following a paradigm that has been successful in other neurodegenerative conditions. So in the study of Alzheimer's, for example, there was a huge effort, the Alzheimer's Neuroimaging Initiative, which was able to show that people who are at risk for Alzheimer's and will go on to develop Alzheimer's show changes in their brain structure early on, even before you start to see cognitive impairment. And so they launched a trial about 3 weeks ago where they're beginning to provide medications to people who are showing these early brain changes that are a risk marker for Alzheimer's, to see whether if you start the medication early on before the symptoms emerge that you could have a greater impact on outcome. So this is the same concept that we're working towards in autism. Now, one of the things as we move into this area and begin to study high-risk infants is to look at the literature that has been developed studying the brain development of children with known autism. And what we do find is that there is an atypical pattern of brain structural development that's characterized by a size of the brain that is pretty much normal at birth, but then rapidly grows faster in size than a typical child, so that by 1 year of age, the head circumference, for example, is about a standard deviation above the norm. And so you see this rapid brain growth. You can see it both in head circumference as well as structural MRI. And then it begins to plateau off. And then as the development continues to occur, we actually start to see some atrophy in some brain regions. But this early pattern of brain development shows enlargement most prominent in the frontal, temporal, and the cingulate